Okay, so let us continue again the second phase of our discussion that is still related on the divisions of pharmacology. But again, we'll have the resumption of the video presentation that we have posted and played a while ago.
Hi, this tutorial is the first in the pharmacokinetics series. So first of all, I should talk about what pharmacokinetics is. Within pharmacology, we often talk about two distinct, but unfortunately unintuitively named branches. These are pharmacokinetics and pharmacodynamics. Briefly, pharmacodynamics is the study of the effects of drugs on the body. That is, what does this drug do to the body? What receptors does it activate? And what other effects does it have? Alternatively, pharmacokinetics is the study of the effect the body has on drugs. In pharmacokinetics, we ask questions like, how does the drug get into the body and where does it go? What does the body do to the drug? And how does the body get rid of the drug? It is this branch of pharmacology that we will be looking at in this series. So let's begin with a pharmacokinetics acronym you'll find in every textbook of pharmacology, ADME, A-D-M-E. This stands for absorption, which is how the drug gets into the body. Distribution, which is where the drug goes to in the body. Metabolism, which is how the body chemically modifies the drug. And finally, excretion, which is how the body gets rid of the drug. These are four elements we need to consider when talking about the pharmacokinetics of a certain drug. The following tutorials will each talk about a certain aspect of pharmacokinetics. But for the remainder of this tutorial, we are going to discuss some of the more boring but incredibly important aspects of pharmacokinetics and pharmacology. So I'll begin by drawing a graph. And here on the y-axis, we have the concentration of drug within the body. And on the x-axis, we have time. So if we give a person a drug at time 0, then we will see the concentration of the drug go up, and then it will fall slowly as the drug is removed from the body. And that's what we see on this graph. So looking at this graph, we can see that in this section, the drug enters the body faster than it is being removed from it. Therefore, the concentration of the drug in the body increases. Then, after the peak of this graph, the drug is being removed from the body faster than it is entering. So the concentration of the drug in the body starts decreasing. This point at the top of the graph is important because it is the highest concentration of drug in the body. Therefore, we call this the maximum concentration, or Cmax. This is important because knowing the maximum concentration can help predict the therapeutic benefit and also the likelihood of side effects. The time at which the maximum concentration occurs is called Tmax. Now, a slightly more confusing concept is the half-life of a drug. The half-life is, by definition, the time it takes to remove half of the current concentration of drug from the body. So let's consider the half-life on this graph. If we begin at Tmax, we want to see how much time it takes for the concentration of the drug to decrease from Cmax to half of Cmax. So here is the half Cmax line here, and therefore the half-life, which is often denoted T half is the time between Tmax and where I've drawn T half here. So just to summarise, the time it has taken for the drug to drop from its maximum level to half of its maximum level is the half-life. On this graph, this is the time between Tmax and where I've drawn T half. There's a lot more to talk about with half-lives.
Okay. When we talk about this graph, you're seeing that when the drug is being administered to the patient, it starts with 0, meaning the concentration of the drug is 100%. And in this way, when the drug enters to the body, it will now decrease the concentration of the drug, simply because when the drug reaches the plasma, that is merely the consideration, once the drug absorption, then it reaches to the blood, specifically to the plasma, that is what we call the maximum concentration level or peak concentration level. Now, if you will notice, when it reached the peak concentration level, this concern also the maximum time that the drug already starts the effect of the drug. Then after the drug has reached the plasma, if you notice, the graph goes down, because that is simply because the liver, the kidneys are already acting on the perspective that some of the drugs that must not be distributed within the body must be metabolized, and once it is metabolized, that comes in yung tinatawag nating excretion. That's why if you will notice, bumababa na ngayon yung concentration of drug. Once the drug reaches this maximum time at yung maximum concentration, ang tawag ngayon dyan, yung half, ay half-life. Example, when the drug is intended to be given 8 hours. So, for example, the drug has been given 8 o'clock, the next dose 4 o'clock. So, meaning the half-life of the drug will reach in between, which is the mid time. So, between 8 o'clock and 4 o'clock, we have the 12 noon, by which possibly the drug already reaches the half-life of the drug, which is 50%. 50% of the drug. So, once the drug is having its 50%, ibig sabihin, the 50% is being absorbed, the 50% is now being excreted out of the body. So meaning, once it reach again the next dose of the drug, which is 4 o'clock, it will reach again the start of 100% of the drug, so that while the 50% is being metabolized, another 100% of the drug will be entered to the body and will reach again the peak concentration level and at least have its 50%. That's why it is very important, class, to consider the right time of administration of drug, because once you will not reach those time, the proper time of administration, it will really affect the 100% effect of the drug, which is what we call bioavailability, and thus will affect also the half-life of the drug, which may not meet the 100%. So 100% is bioavailability and 50% is half-life of the drug. That's why it is very important to consider that the drug must be given on the right time. Now, as we go on with our discussion, it considered the point that the pharmacokinetics is referring to the movement of the drug across the tissues and until to the target organ, by which it will reach the systemic circulation. So we have also already discussed the 4 stages of drug movement. Now, as we discuss the 4 stages of drug movement, I will now again show to you the video presentation that will clearly discuss about absorption. Let us watch this.
Hi, this tutorial is the second in the pharmacokinetics series. And in this video, we're going to have a look at absorption, or more specifically, routes of drug administration. If you haven't seen the previous tutorial, I highly recommend watching it before continuing with this video, as we will use terminology which was introduced and defined in that tutorial. So I'm going to begin by drawing a very simplified body plan. And this body plan follows the flow of blood from the digestive system to the arterial circulation. So let's see how this happens. So blood flows from the gut to the liver via the hepatic portal system. Blood then flows from the liver back through the venous circulation and into the right side of the heart. The blood then flows through the pulmonary arteries to the lungs. Then from the lungs back to the left side of the heart, then out into the aorta and into the arterial circulation. What we are going to do is place drugs into different parts of this system and measure their concentration in the arterial circulation over a period of time. So I'll draw a set of axes, and on the y-axis we have blood concentration of drug, and on the x-axis we have time. We'll begin with the most common route of drug administration, which is orally. These drugs move through the digestive system and get absorbed by the gut. Then they move through this whole system, that is, the liver, the venous circulation, the heart, the lungs, back to the heart, and then to the arterial circulation. This takes quite some time, so what we see is a slow rise in the blood concentration and then a slow fall. Note that the Cmax is quite low and the Tmax is quite large. We'll now contrast that with intravenous administration. Assume that we give the same dose of the drug intravenously, and for those who have read ahead, this drug does not undergo first-pass metabolism. In intravenous or IV administration, the drug doesn't have quite such a long journey to reach the arterial circulation, as it only has to go to the heart, the lungs, back to the heart, and then to the arteries. This results in a quicker rise of drug concentration, which might look something like this on the graph. Note that the Cmax is larger and the Tmax is smaller, even though the dose was the same. This is because IV is a more direct route of administration than orally. Now contrast this with inhalation of a drug. Let's again assume that we have given the same dose of the drug as the last two examples, but this time we are giving it as an inhaled form. Many anesthetics are actually given this way. The drug now only has to go to the heart and then straight on to the arterial circulation. This means we will see the concentration of the drug shoot up very quickly. So note the much larger Cmax and the even smaller Tmax via this route of administration. Also, remember that in all these three examples, the dose of the drug was identical, only the route of administration changed. So you can see how different routes may cause a radically different Cmax and Tmax. This is important when considering the applications for certain drugs. For instance, if you need pain relief quickly, then an IV analgesic will get into the system much quicker than an oral one. Conversely, a drug which has side effects at high concentrations may be toxic if given intravenously, but the same dose might be safe if given orally. Now I have three more points I want to make. Firstly, note that the area under the curve is the same for all these routes of administration.
Okay, so let us analyze the presentation a while ago. With the presentation a while ago, we've seen. Let us try to review on the perspective of the circulation. In the circulatory system, we all know that the unoxygenated blood are located in the vein, and from the vein, it enters the right side of the heart, then to the lungs, and becomes oxygenated. After the lungs, once it becomes oxygenated, it will enter to the left side of the heart, then goes to the artery, which is the aorta, and systemic circulation. As what I have mentioned unto you, once the drug reaches the plasma, there could be uh, a greater effect that the drug will have its time shorter that will reach its peak concentration level. So just like for the oral medication, from the oral medication, the drug will pass through the gut, and as it passed through the gut, it will be detoxified by the liver. Once it will be detoxified by the liver, that is what we call first pass metabolism or first pass effect. Every oral drugs will certainly consider hepatotoxic and nephrotoxic. That's what I have mentioned up to you, because most of the oral drugs will pass through the liver, and the liver will definitely work as it is oriented to be. So that's why the more drug, for example, the patient may have, the overdose that the patient may have, the higher chances that the liver will forcefully act on its function. And that's why there are chances that it will lead to toxicity. So if you will notice, after the liver will detoxify it, that's the time that it will reach palang the blood plasma until it enters the heart, the lungs, the left side of the heart until it proceeds to the systemic circulation. Unlike for the drugs that are given direct intravenous, because compared to the oral, the drug already reaches the plasma. So it's shorter time that it will reach the systemic circulation. So left side of the heart, right side of the heart, to the lungs, left side of the heart, to the artery and systemic circulation. Moreover, if the drug is given directly to the lungs, which is inhalation, probably through the endotracheal tube, there is a shorter time, but peak concentration level already, because the lungs already reach the oxygenated, rather the drug already reached the oxygenated blood, reaches the left side of the heart, and then goes to the systemic circulation. From this y-axis and x-axis, it means that in here, the dose of the drugs are the same. All are the same. But it has an effect with the time because of its route of administration. Just like what we have mentioned here, we have here a longer time for to have the peak concentration level of its half time, simply because it will still pass through the gut then the liver. Compared to the intravenous, it already reached the peak concentration level immediately compared to the oral, because it directly reach the plasma. Anything that reach the plasma already is the maximum concentration level. Unlike for the lungs, that has a shorter pace to reach the systemic circulation, it already reached the higher the peak concentration level with the shorter time, simply because it reached already the plasma until systemic circulation. I hope this video presentation have given you an overview of what is the importance, why do we need to be aware and to still review anatomy and physiology, because it has an implication certainly on how we will best describe that drug will take into the effect of the body, and it is directly associated with the physiologic response of the body. To continue, in the pharmacokinetics or absorption, okay, certainly we have to consider the point that how the drugs are being absorbed. So obviously, as what we have mentioned, it is dependent on how the drug took place from the administration site across the tissues and eventually towards the systemic circulation. So once it reach already the systemic circulation, that's the time that is already the measure of how the drug have taken its effect and reached the distribution already. So okay, so it just hang, the presentation just hang. Let's continue. Okay, so I'll just need to reopen again the PowerPoint because of the hanged video presentation for a while. So in this perspective, there are also factors that may significantly consider the effect of the what we call uh, what are the factors that may consider the problem with absorption, or it could be dependent by absorption. So let us just open again the presentation. So other than that, I think we could consider also on the age that can possibly affect the absorption, health condition that can possibly affect absorption. So the population groups, if you will notice, we have different preparation of drugs because it has also different effect by age group. That's why if you will notice, there are some drugs that are particularly considered on the action of drug, which is uh different from children, which is prepared by syrup or by suspension, and it is different preparation as well for the adult. Although for adult and elders, it could be the same, but the aspect that the response of the body could be different from adult compared to the elders. Kasi by elders, the problem is it very slow ang effect due to the concern certainly that in the increasing age, the slower is the metabolic response. So let us continue. Okay. On the perspective wherein absorption, as what I have mentioned, this has been the one that I am telling you or reiterating to all of you that in the administration site, you must consider AAS. So it is greatly dependent on the administration site and the time. Later on, we'll try to realize the importance of why we need to know administration site and at the same time its implication to time. So the degree and rate of drug absorption is dependent on the following. Administration route, as what I have mentioned. The effect of the drug may reach its maximum concentration level if it reach already the plasma. Intravenous may have faster effect as expected compared to oral drugs. Another is patient age and physical condition. As what I have mentioned, for elders, there could be possibility of slow response of drugs. Eventually, they are the ones who are high risk and may have, that's why we call the elders as ano, di ba? A highly vulnerable population because they are more vulnerable, most vulnerable in terms of the response and defense on the on in terms of health diseases and illnesses. Just the same as for the drugs, elders could possibly may have slow response because of the decreased metabolic rate. Third, the water solubility of the drug and lipid solubility of the drug. If we say water soluble drug, this could be easily lead to its breakdown of the chemical components of the drug once it reach the stomach. Pag if we say lipid soluble drug, these are drugs that eventually has longer effect because it stays in the blood longer. And again, if when it comes to solubility, we all know that lipid may have a slow solubility. So third is potential interactions of drugs. As what I have told you, there are some drugs that may affect its absorption once mixed with other drug or once it mixed with other or with food. So eventually, and certainly on the absorption, I know that this has been oriented to all of you, and this you have been given the overview certain on the medication administration routes. So we have enteral routes and we have the parenteral routes. So the enteral routes are those administration of drugs that had been that is absorbed within the GI tract, and parenteral routes are those drugs that are given outside the GI tract. So let's have a review. If we talk about the oral medication, just remember the two-cast GIP. What do you mean by two-cast GIP? It is just I just put the blue text on this so that for you to be guided and to remember some of the important points when it comes to medication administration routes. So just like two-cast GIP, ibig sabihin ng two-cast, 2C, 2Cs are convenient and common. Okay, convenient and common. AS meaning it is absorbed slowly. GI, most of the time, this causes gastric irritation. And letter P, usually the typical root for pain. So again, 2 CASGIP, 2 Cs meaning common, convenient, AS, absorbed slowly. GI, most of the time it causes gastric irritation. And letter P, typical root for pain. We are aware of the preparations. The preparations could be tablet, capsules, powders, or liquids. So again, the preparation correspond with the age group. The dose correspond also with the age group as well. And this could be in a way that the drugs are made and manufactured that will fit according also to age group and to the response of the drug. Now, let us proceed to the buccal. So for buccal, we have the CGUP. What do you mean by CGUP? CGUP meaning CG, the drug is being administered between the cheeks and the gums. And pH meaning there's a need to have high level or optimal level of pH for the drug to be absorbed. What do you mean by pH? The pH is the concentration by which it will help the drug to be absorbed. Pag low pH kasi or high pH, there is a disadvantage kasi it could be acidic or alkalinic. Pag too much acidic, there could be a possibility that it may cause the premature breakdown of the drug. Kung alkalinic naman, it counteracts or contradict the absorption of the drug. So certainly, it must reach the balance of the level of optimal strength so that this drug will be uh, absorbed via buccal. Ngayon, those drugs that you may encounter that are given buccal or via buccal are those drugs, pain relievers for cancer patients. Okay, for cancer pain. And one of the example is basically fentanyl. Okay? So, again, if we go back to the oral, we have two CASGIP, most common and convenient. AS absorbs slowly. Then, most of the time, it causes gastric irritation and typical root for pain. While the buccal is we have the CGUP, which is mainly considered as the drugs that are being administered on the cheeks, between cheeks and gums, and may need optimal level of pH. Next, let us now proceed with sublingual. Actually, when one of the questions had that been raised, sir, how the drugs are being absorbed under the tongue. Remember, the more that the site is considered as highly vascular, the chances that it could start absorption. Just like, sir, paano po yun? We are just aware that the drug for oral will reach the stomach will be absorbed by intestine. Why under the tongue? It could be also considered as one. Kasi alam nyo po, ang oral cavity natin, especially the tongue, are highly vascular. Kaya that's why when the drug is being placed under the tongue, it could already reach and absorb via the intravenous. And once it is absorbed, it can reach the plasma. Kaya usually most of the emergency drugs are given under the tongue because of reach in the blood vessels and can possibly reach the plasma as well. So if we consider TARBs are are the mnemonics that we consider because drugs letter T are given under the tongue. This is absorbed rapidly, unlike for the oral, absorbed slowly. And BS, it's directly in the bloodstream. Okay, the sample drug that we may have here is nitroglycerin. And nitroglycerins are vasodilators, meaning blood vessel, dilate. So it opens the blood vessel. This is usually indicated for angina. Angina is the medical term for chest pain. Now, when you're giving nitroglycerins, usually it is given under the tongue. And usually, nitroglycerins are given 3 times every 5 minutes. Kaya, if given 5 milligrams for first 5 minutes, the patient did not experience relief, you can still give nitroglycerin for the next 5 minutes of 5 milligrams. And maximum of 15 minutes, meaning maximum also of 15 milligrams for the nitroglycerin. Kasi remember, the concept itself, pag the patient still continue to experience chest pain, beyond 15 minutes, it's already myocardial infarction or heart attack. Remember, chest pain is being experienced by the patient if there's insufficiency of oxygen that reach the cardiac muscle. Insufficiency pa lang po. Ibig sabihin, lack of oxygen. Pag already a consideration on death of muscle tissues and its infarction, meaning death, that's a point that could lead to a complication and may lead to heart attack. So that's why it's very important to consider na these drugs such as vasodilators given sublingually, nurse must be aware of its implication and on how the drugs are having its conventional effects sa patient, and now once it reach to beyond 15 minutes, it will lead to heart attack or myocardial infarction. Next, let's proceed to rectal. Okay, rectal, ang tandaan lang po natin ay right. So right meaning R, rectal or rectum, given rectum. AIT is absorbed in the intestinal tract. Okay, right. So there are some drugs, example drugs that are being given via rectal. These are familiar with you. Rectal laxative. These are usually laxatives. Pag sinabi nating laxatives, these are drugs to facilitate concerns or treatment for constipation because it facilitates contraction of the intestinal motility. So remember class, kung kayo naman ay nagda-diarrhea at nag-take kayo ng Bisacco, di lalo kayong magkukos ng diarrhea kasi mag-i-increase yung intestinal motility. So that's why nga ang concern dito, ito ay given during constipation. Another is kung ang patient is experiencing rather febrile convulsion, and the patient can take oral paracetamol. There is also a paracetamol suppository, lalo na for infant, children. Usually these are given via suppository. Ang question, sir, bakit sa rectal? Kasi tandaan po natin, rectal intestine, ang intestine po ay highly vascular. Pag reach sa blood vessels ang isang site, the more that it could facilitate fast absorption. So clear? So again, let us review. For oral medication, 2-CAS-KIT, convenient, common, CAS, AS, absorbed slowly, causes gastric irritation, typical route for pain. We have for the buccal, SIGUP, the drugs are being administered via cheeks or between cheeks and the gums and may need optimal level ng pH or concentration. Next, we have the sublingual, TARBs. So what do you mean by TARBs? Drugs are being absorbed under the tongue, AR, absorbed rapidly, BS, direct bloodstream. Next, RAIT, rectal. Rectal naman is drugs being administered or inserted by a rectum and absorbed in the intestinal tract. Let us now proceed with medication administration via parenteral. So via parenteral, we have defined that those drugs that can be administered outside the GI tract. And one of the most common is particularly the intravenous. Pag sinabi nating intravenous, let us remember DUBs. What do you mean by DUBs? Drugs that can be administered directly to vein. So DUBs meaning the action is direct access to bloodstream. Direct access to bloodstream. So what is the blood vessel? Vein. So this is commonly used for intravenous fluid o yung what we call suero. Because eventually drugs, for example, for severe dehydration, usually if it is not taken by oral kasi papastro pa yun sa GI, so intravenous fluids are being administered agad to facilitate the fast effect of the drug and hydration as well kasi to hydrate the cells may pass through the plasma already. Other than the intravenous, we have the what we call intramuscular. Okay, for intramuscular, let us remember po ang ML, hindi yan Mobile Legend, MLHSD3. Okay, pag sinabi nating ML, the drug is being administered via muscle, LH, less hazardous. Tapos, we have the SB, stays in blood longer. Kaya when the drug is being administered intramuscular, matagal yung effect niya. Kaya pagka minsan may mga situations that you are being vaccinated intramuscular, medyo matagal din yung nararamdaman yung pain. Kasi ano din, it stays longer, para mag-reach yung effect na yon. Ang tatandaan, you need to remember lang po the maximum volume of drug that can be tolerated by the muscle, by the muscle per IM, 3 ml. Do not administer any drug beyond 3 ml because that will reach muscular tissue or muscle tissue damage and possibly may lead to other than damaged tissues, pwedeng mag-lead yan sa tissue death or pwedeng mag-lead into infection. So that may lead to the point of the what we call negligence. Other than that, let us be careful also. Let us be careful also in the perspective that it is not recommended to be administered ventrogluteal or dorsogluteal. Why? It is not administered ventrogluteal or dorsogluteal kasi uh, maraming nerves po na present dito and possibly na this this may not cause this may cause a possible hitting of the nerve kasi once ma-hit po kasi ang nerve chances po na pwedeng mag-cause ng paralysis. Okay? The we can basically consider uh, the point we can consider the point that on the perspective of this drugs being administered intramuscularly, careful po because again this will facilitate a concern that will cause paralysis as mentioned. So one of the example of drug that can be given dito that may have a longer effect ay yung tinatawag nating antipsychotic drug. Example is haloperidol. Okay, haloperidol is different from tramadol kaya sabi ko nga sa inyo you need to consider din po yung mga suffixes and eventually be familiar with it. Again, in pharmacology, you don't need to memorize all of these drugs. But for you to be oriented with suffixes, will soon I'll be introducing to you how to know and classify drugs according to suffixes. So now, let's proceed with other than the intramuscular, we have the subcutaneous. Pag sinabi nating subcutaneous po, these are these are drugs that are basically administered FTSM2. What do you mean by FTSM2? FT, it's the drugs being administered in fatty tissues and it's between the skin and muscle. The amount of volume that can be tolerated in the subcutaneous is 0.5 to 2 ml only. Remember, pag 3 ml, be careful na. Hindi na to pwedeng matolerate at ano na yung maging effect. The effect is if it is too much, it's exceed rather 2 ml. This may cause the possibility that it may cause irritation of subcutaneous tissues, pwedeng mag-cause ng tissue irritation and injury, pwedeng mag-lead into tissue death, and somehow may cause the possible infection. So, other than that, ang tatandaan po natin sa intramuscular, it stays in the blood longer. Okay? Pag dito naman sa subcutaneous, gradual absorption. Bakit gradual absorption? Kasi pagka fast yung absorption compared sa intravenous, ito yung mga drugs na hindi binibigay through intravenous. Why? Kasi pwedeng mag-cause siya ng possible complications. Example, insulin. Insulin, we are aware that this drug rather is being given to patients with hyperglycemia or uncontrolled diabetes. Pag ang insulin po ay in-intravenous ninyo, that could cause a possibility of sudden drop lalo na kung rather controlled yung diabetes. Kasi yung pag control ng diabetes, situations lang na binibigay, circumstances lang na binibigay ang insulin. Pero pag uncontrolled yan yung time na routine na binibigay yung insulin. Pero if ever ang insulin is being given intravenously, ayan, this will cause a sudden drop of the blood sugar at pwedeng mag-lead yan sa hypoglycemic shock. So that's why it is not given intravenously. Sir, bakit hindi binibigay ng intramuscular? Intramuscular naman yan, it stays longer. Baka naman ang mangyari, it stays longer, mabagal naman yung pag-manage ng blood sugar level. Kaya that's why it's given subcutaneously kasi gradual lang niyang binababa yung blood sugar. Similar also with drug as heparin. Lahat ng drugs ending in rin, warfarin, aspirin, heparin. And if we talk about coagulation, kasi di ba for example, if there's injury of tissue, magbi-bleed yan. Pag nag-bleed yan, di ba it stop bleeding? Kasi nagko-cause na siya ng blood clot. So similar also, pagka nag-cause ng damage ng blood vessel, pag nag-cause ng damage ng blood vessel, mag-cause siya ng bleeding. At mag-cause yan ng bleeding, pwedeng mag-blood clot. Yung clot ba yon pwedeng mag-cause ng obstruction? The answer is definitely yes. Pwedeng mag-cause yan ng obstruction sa blood vessel and eventually pwedeng mag-obstruct at ma-delay ang circulation. Usually, ang mga anticoagulants, binibigay yan sa mga stroke patients or patients who have experienced heart attack. Kaya careful din tayo sa pagbibigay ng mga heparin injections or anticoagulant lang, mga erythropoietin injections kasi it must be given subcutaneously dahil gradual lang niya mina-manage yung pag-prevent ng clotting. Kasi pag binigay mo yan intravenously, ang problema diyan ay pwedeng mag-cause yan possibility of bleeding kasi mabilis yung effect at mag-cause yan agad ng bleeding. Unlike doon circumstances na kailangan gradual lang po ang effect of drug. So these are the drugs being given. So yun ang tandaan ninyo ha, pag subcutaneous, gradual ang absorption. Pagka intramuscular, stays longer in the blood. Pagka ano naman, intravenous, it's absorbed directly to the bloodstream. So uh, rapid din yung effect of the drug. Okay. So don't be overwhelmed with this slide because this is just a summary of what we have discussed eventually on the nursing responsibilities and the different rules of administration of the drug. Uh, you could see in this are the methods, the rights of medication, the forms, and nursing responsibilities. This could be explored as we go on with the succeeding discussion that we may have. Now, let us now proceed to the relationship of time and route of administration. As what I have reiterated, ito yung administration site is directly related sa time. Dun sa graph na pinakita natin, when the drug is being received by the body, it has a corresponding association with the element of time. Example, if the drug reaches directly sa plasma, mas mabilis yung effect ng gamot. Kaya if you will notice, sa intravenous, we have only 30 to 60 seconds. 30 to 60 seconds. So how about intraosseous? Intraosseous, when drug is being administered directly to the bone. O sir, what's the concern with the bone? Kasi the bone definitely uh, responsible for the production of red blood cells. So it will facilitate in the circulation. So mabilis rin mag-reach sa plasma. So 30 to 60 seconds. For endotracheal, and inhalation. Pag endotracheal, if you've seen individuals who may have tube inserted in the mouth, that is directed to the trachea. Yun, ibig sabihin directed to the airway passages and the airway. So, endotracheal and inhalation could be via those drugs such as anesthetics, use of the oxygen mask, so nebulization, yan yung mga inhalation. So the effect is 2 to 3 minutes. Sublingual, under the tongue, the effect of drugs is between 3 to 5 minutes. Intramuscular, we have 10 to 20 minutes. Subcutaneous, we have 15 to 30 minutes. Rectal varies 5 to 30 minutes. If you compare intravenous to the ingestion, if you will see, uh, you can observe 30 to 90 minutes, 'di ba? 1.5 hour. 1.5 hour that the drug will be taking into effect compared to 30 to 60 seconds. Kaya in case of emergency, it's very rare to give oral medication because eventually we are attending to emergency situations. So we need also the drug that can definitely support urgent response of the body. So make this as a way make this as a way of reference and have a mastery of this time for you to know the essence of why we need to know that every route of administration has a corresponding effect when it comes to the time. Now, uh, we'll proceed with the concepts of the pharmacology, certainly on some of the terms that we encounter when it comes to other stages of the pharmacology. Actually, when we had our uh, survey, what the common medication safety issues that was reported is certainly on the overdosage and or underdosage, non-compliance with prescribed medication, non-reporting of adverse reaction, and overload of patient assignments. What transpired in the survey was overdosage or underdosage. Question, meron po bang namamatay sa underdosage? The answer is yes. Kasi kung for example, if the patient did not reach the appropriate dosage to have its desired effect, then it may lead also to infection. Example, if the patient was diagnosed with severe infection, then the dose of the drug is not the expected drug that has been computed. The problem is it did not reach the inhibition of the growth of microorganism. So it still spread the microorganism and cause the complication from the severe infection. So certainly with overdosage, the problem with the overdosage is the damage, possible damage and complications to the liver and the kidney. These four are common medication and safety issues, but moreover, the realization the revelation or rather the results are have been revealed on the overdosage and underdosage. Now, there are terms, there are basic terms that are associated in the drug movement. Okay, one of which is certainly on this. Example, I know for a fact that you have studied about the process of diffusion. So sa diffusion, we have the process from the higher concentration to lower concentration. If you will go back to the graph that we have discussed, 'di ba nag-start siya from zero, pumanik siya sa peak concentration level because the drug reaches the plasma. Tapos bigla siyang nag-lower concentration kasi ibig sabihin the drug is being absorbed by the body and some parts of it are being excreted by the body. So yun yung tinatawag nating concept of diffusion. Now, if we talk about pinocytosis, yung concept naman ng active transport through pinocytosis, the cells are filled with fluids. 'Di ba? Meron tayong uh, extracellular compartment at saka intracellular compartment by which the extracellular and the intracellular compartment has also fluid. And we all know that those fluids are capable, just same as plasma, are capable of carrying, okay, are capable of carrying those nutrients and drugs to be absorbed by the body. So these are the two concepts, the passive transport, which is on diffusion, and the active transport on pinocytosis. So now let's have a video presentation that by which for us to do understand how distribution and metabolism takes place within the body. Let's listen to this presentation.
Hi, in this tutorial I'm going to talk about the distribution of drugs within body compartments. In the previous tutorial I said that this video would be on the metabolism of drugs, but I've decided that it's probably best to talk about the distribution of drugs before we move on to metabolism. For the purposes of distribution, we can consider that the body is made up of four major compartments, which are really collections of fluid, and numerous minor compartments. These major compartments are the blood, or strictly speaking, the plasma, fat, extracellular fluid, and intracellular fluid. Then there are numerous other minor compartments. These include the cerebrospinal fluid, the peritoneum, synovial fluid in joints, and the fetus in pregnancy. There are numerous others, but for the purposes of this tutorial, we'll consider these as one single compartment. So if a drug is placed into one of the compartments, we can see how it might move and distribute into other compartments. Often drugs are placed into the blood. These are drugs which are given intravenously. So when a drug is placed into a compartment, it often associates with binding molecules. These binding molecules are often proteins such as albumin. This process sequesters the drug within the compartment, effectively increasing that compartment's storage capacity. And there is an equilibrium maintained between the bound drug and the unbound drug. The unbound drug within a compartment is then able to move into a new compartment, and thus an equilibrium is maintained between adjacent compartments. When a drug moves into a new compartment, some of that drug is sequestered by binding molecules within that new compartment. This process continues until there is a balance between each compartment and a balance between the amount of free drug versus bound drug within each compartment. The balance between each compartment is determined by a number of factors, and this is best represented using an equilibrium constant. If you've ever done much chemistry, then you'll have definitely seen equilibrium constants before. But if you haven't, then all you need to know is that they are a number which shows whether the balance is in the forward direction or in the back direction. I'm not going to discuss equilibrium constants further here, but I am going to talk about the factors that affect whether drugs would prefer to move into one compartment versus another. Thus, I can say that the equilibrium constant is dependent on the permeability of barriers between compartments, the pH within the compartment, the binding capacity within the compartment.
Okay, so on this video presentation, this is the time that we're talking about distribution. Okay, so when the drug reaches the plasma, this is now the time that it will be distributed to the target, so the target organ. Ngayon, if the drug is intended intended for joints, okay, for joints, first and foremost, from the plasma, papasok yan muna sa compartments of cell. Okay? From the compartments of cell, we have the extracellular and we have the intracellular. If we say extracellular, it's the outside compartment of the cell that has fluids. Then now enters the intracellular. Pagkatapos sa intracellular, then that will also consider the other fluids based from the target organ. Just like for example, we have the CSF, the cerebrospinal fluid, which are fluids that being transported via the spinal cord and the brain. Peritoneum is the peritoneal cavity wherein it envelopes the internal organs of the abdomen. Synovial fluid are the fluids that are present in the joints. Fetus, obviously, we have the amniotic fluid. Sa lungs, we have the pleural fluid. Sa lungs, we have pericardial fluid. So these fluids are very important for the transport of the drugs. So eventually, if the drug enters from the plasma already, di ba yun yung sabi natin, across the tissues until it reaches the systemic circulation kasi nasa plasma na siya. So pag nasa plasma na siya, i-distribute na siya doon sa appropriate or target organ, pa-follow through na yan doon sa cell, from the cell to the target organ through the fluids that are eventually very supportive para mag-take effect doon sa target organ. Now, when we talk about the distribution, we are talking about the systemic circulation. Okay? When the drug enters to the plasma, papasok na to into tissues. Sa tissues na tayo. Kaya that's why if we go back to the absorption, AAS, we have administration site, across tissues, then systemic circulation. Pagpasok sa systemic circulation sa plasma, papasok na siya ng tissues. Now, there are physiologic factors na pwedeng maka-affect sa movement ng drug. Example, we have the blood-brain barrier. Ang blood-brain barrier or BBB ay obviously nasa brain. These are endothelial tissues that protects the brain from being damaged, that protects the brain from various toxins. Kaya that's why when drug enters the brain, pwedeng maka-affect 'yan sa distribution of the drug, lalo na kung halimbawa if the blood-brain barrier is basically damaged, so it may not detect if the substance, the chemicals that enters the brain is supportive of the indication for the drug to take effect. Usually pag example ang blood-brain barrier pagka may mga pumasok diyan na mga toxic substance, ah, bacteria, microorganism, blood-brain barrier ang mag-cause ng ano diyan, ng barrier para ma-hold at mag-cause ng damage. However, pag ang blood-brain barrier is damaged, that will cause a hindrance para mag-cause ng, effective distribution of the drug. Next, cardiac output. For the cardiac output, the normal cardiac output is 5,000 ml per minute or 5 liters per minute. Now, situations like if the patient is experiencing anemia, then obviously there could be a delay in the distribution of the drug. Kung ang patient naman ay on the other hand ay yung mataas ang RBC or polycythemia, slow naman ang movement ng blood kasi highly viscous ang blood and delay din ang pag-distribute ng gamot. So that's why it's very important for us to know the cardiac output. So next po, body composition. Okay, obese, between obese and the underweight. Alam niyo po class, the same problem po ito sa distribution. 'Pag obese, slow ang metabolic response. So ibig sabihin slow din ang pag-distribute ng drug. So similar also with underweight, dahil underweight, the problem is slow din ang distribution because the fluids are not sufficient so that it will reach the target organ. So other than that, there are some situations also na pagka example, if the patient is under the influence of alcohol, puwede ring mag-cause din yan ng, delay in the distribution of drug. Why? Kasi the alcohol, increased alcohol level itself may cause constriction of blood vessel. Okay? So that particularly may affect. Other than that, smoking, the nicotine itself may cause nicotine itself may cause constriction of blood vessel, and that may also hinder distribution of the drug. So on the basis that the plasma itself is the problem and yung protein kasi protein is the one that binds para ma-distribute yung ating pong, chemical properties of the drug. 'Pag meron tayong problem with the plasma protein, either lower level of plasma protein, that will greatly affect the distribution of the drug. Now, other than the distribution, I will be showing to you and presenting to you a video presentation that will basically identify metabolism. Let's watch.
Hi, welcome to the fourth handwritten tutorial on pharmacokinetics. In this tutorial, I'm going to talk about drug metabolism. Drug metabolism often takes place in the liver, but metabolism can take place elsewhere, such as in the lungs or the gut. The fact that most drugs get metabolized by the liver is very important for pharmacokinetics, because drugs given orally may be metabolized by the liver before they reach the systemic circulation. This phenomenon is known as first-pass metabolism. Sometimes first-pass metabolism is so dramatic that it necessitates giving a drug intravenously, as giving it orally would lead to significantly less active drug in the systemic circulation. Morphine is an example of this, which is why it is so often given intravenously rather than orally. However, in this tutorial, I'm going to talk more about the biochemistry of drug metabolism, in particular, the actions of cytochrome P450 enzymes, which are often abbreviated CYP. These cytochrome P450 enzymes are abundant in the liver and different types metabolize different drugs. For example, CYP1A2 metabolizes caffeine, whereas CYP2E1 metabolizes alcohol. Cytochrome P450 enzymes metabolize drugs through a variety of processes. These include oxidation, hydrolysis, and hydroxylation. So let's have a look at how the
Okay. When we talk about the cytochrome 450, this is the one, the enzyme that is facilitated by the liver to metabolize the drug. As what you have heard in the video presentation, there are different CYP that metabolize caffeine, CYP that metabolize alcohol, CYP that possibly metabolize nicotine. So ang CYP450 is the one that really metabolize drugs. Kaya remember that the liver has many enzymes, and kung imagine, can you imagine if it will continue, if the patient is taking drugs specifically addiction, or are in drug addiction, smoking, alcohol drinking. Can you imagine how the liver extensively releases these enzymes of cytochromes? So that's why eventually this could cause a damage to the liver if ever the cytochrome or the CYP of respective metabolic responses may not be sufficient. Kasi it should be one at a time. But if this could possibly consider all of this are together and may cause the metabolism of the liver, I think this may reach to the point of scarring of liver, which is cirrhosis, and sooner or later may cause a possibility that the liver will be damaged. So in the metabolism, we take into consideration that most of the drugs are being metabolized on the following. Most, as mentioned, is in the liver, and eventually plasma, because this is carried obviously via the plasma. Kidneys, so these are the major the two major organs responsible, and intestinal membranes. That's why if you will notice, if the drug is being metabolized via the liver, then it may facilitate excretion via kidneys and intestinal membrane. So if you will notice, ano yung evidence if the kidney is the product of metabolism through kidney, di ba discoloration of the urine. Example, if the patient have taken multivitamins, then eventually there is an observation of discoloration of urine, which is almost bright yellow. If the patient is taking an anti-TB drug, such as rifampicin, the patient eventually observe a dark-colored urine, because that is eventually the result of metabolism from the liver and the kidneys. There are situations that most of the observations are being documented naman via stool, na akala ninyo if there is dark-colored stool, you might observe na, baka may intestinal bleeding. Yun pala, hindi. You need to ask the patient if the patient took a drug such as iron-based drug. If you're taking a ferrous sulfate or iron-based drug, most of the metabolism is in the intestinal membranes. That's why the stool could be dark-colored stool. It's not basically because of intestinal bleeding, but because it's basically the metabolic outcome of the ferrous sulfate. Okay. Usually, metabolism could be greatly affected by genetics. Okay, for example, since we have identified that the drugs could be metabolized on the liver, the plasma, the kidney, intestinal membrane, any genetically acquired, inherited diseases, familial history of these affected organs will basically determine a problem with metabolic response of drugs. Other than that, as what we have mentioned, if physical conditions affecting or diagnose with these organs, this may facilitate the problem with metabolic response. Patient age, as what I have mentioned, iba ang response ng child, adult, and at the same time elders because of the metabolic activity. And as what I have mentioned, the drug itself, yung sinasabi ko nga sa inyo, yung kung water soluble siya or lipid soluble, that greatly affect in terms of metabolism. Now, kanina we have talked about first pass effect. Okay. The first pass effect usually are being influenced pagka orally administered drug. Kasi usually it will pass through the intestinal membrane then once it passed through the intestinal membrane, that intestinal membrane and being absorbed, kasi absorbed once nag-reach yan ng plasma, si liver na ang magme-metabolize niyan. It's either the drug will be metabolized and be excreted via urine or via the intestinal membrane. So this is what we call the first pass metabolism. So as we go on with our excretion, this is the video presentation that will basically explain what excretion is. Let's watch.
Hi, this tutorial is the fifth in the pharmacokinetics series. In this video, we'll be discussing excretion of drugs. Excretion is defined as the irreversible removal of drugs from the body. There are two main ways in which the body excretes drugs. One is via the hepatobiliary system. This is when the liver excretes a drug or a drug metabolite into the bile, which in turn gets excreted with the feces. An example of a drug which is primarily excreted by the hepatobiliary system is the antibiotic rifampicin. However, most drugs are primarily excreted by the kidneys. As such, we will focus on this system in this tutorial. In this system of excretion, a drug gets filtered into the nephron of the kidney. If you want more information on the details of this, check out the nephron function tutorial and other kidney tutorials at handwrittentutorials.com. Once the drug is in the nephron, it flows through the nephron into the collecting ducts and ultimately out of the body in the urine. So we can define some values here. First of all, there is a certain concentration of the drug in the plasma. We'll denote this Cp. Secondly, there will be a certain concentration of drug in the urine. We'll denote this Cu. Finally, there will be a certain rate at which urine is
Okay. When we talk about excretion, as mentioned, the liver facilitates metabolism. The excretion process could be via kidneys or via the intestinal membrane. However, the nephrons or the basic units of the kidney have the major responsibility when it comes to the excretion. Uh, Whenever drugs will be metabolized, usually and most of the time, the higher percentage will be via the kidneys. That's why, again, if we have problems or health conditions that greatly affect the kidneys, it will particularly affect the what we call excretion. And sometime or most of the time, this will cause the retention of toxins or retention of supposedly substances or chemical properties that will be excreted by the body. Doon na tayo nagli-lead sa toxicity. Kaya malaki ang action definitely and function of the kidneys. Now, what are the major routes of the excretion on the elimination of drug? The major excretion routes are the following. It could be kidneys through the urine, liver or bile, it may appear through feces. Lungs could be via exhalation of air at yung breast milk. That's why very important po sa atin to take into consideration those drugs that are being given through nursing mothers because we all know that it could be excreted via breast milk. So similar also to the situation that drugs can be also be given to a pregnant mother. So this will considered for the maternal to fetal circulation. Minor excretion of roots could be saliva, tears, or sweat. Kaya remember, there are some drugs that once administered to the patient, nagmamanifest sa amoy. So similar also with the alcohol. When when the individuals have taken the alcohol, it will manifest through breath. It will manifest through the sweat or odor. Now, in particular, what are those basic terms that are very important when it comes to the pharmacology? Those are factors that determine the proper dosing schedule. So this could be the last slides that will cover the topic 1B topics. So a while ago, we have mentioned about the route of administration. So basically, this refers to the area where drug absorb are taking place. So ang sabi natin, di ba we have explained yung route of administration vis-a-vis with the time. So that's why with those information that we learned today, it is now significant. It has a direct significant association and relationship if we talk about route of administration and time. Kaya that's why it is very important to consider na yung 2 to 3 seconds na yon sa intravenous, yun pala yung 100% na nagre-reach na siya agad sa bioavailability. Okay? If we talk about onset of action, from the term itself, onset, when the drug reaches the plasma, doon na magi-start yung therapeutic effect of the drug. What do you mean therapeutic effect? Yung desired effect of the drug. From the term itself, begin. Begin is meaning onset of action. Ano naman ang pinagkaiba niya when we talk about duration of action? When it comes to duration of action, this refers naman yung entire effect of yung length of time of the drug from the time that it has already entered the body until nag-reach siya sa therapeutic effect. Yun yung duration of action. Yung onset of action from the term itself, onset is the beginning when the therapeutic effect begins. So kanina we have discussed about peak concentration level. So pag sinabi natin peak concentration level, that is the time when the blood reaches the plasma. So yun yung maximum blood concentration level wherein magi-start na yung half-life of the drug. Wherein pag sinabi naman ng half-life of the drug, that is already the 50% and the bioavailability is the 100% effect of the drug. So now we are on the perspective wherein we will have our self-assessment exercise. Okay? On the self-assessment exercise, the chat box is open for you to respond. It's a way on how you will uh, learn, and this is also an evaluation if you have learned from what we have discussed on the topic 1B that we have considered. So question, the nurse administered the drug intravenously which is expected 100% absorption. Is it referring to bioavailability? Is it half-life? Is it duration of action? Or is it onset of the drug? Again, chat box are open. The nurse administers the drug intravenously which is expected 100% absorption. Bioavailability, half-life of the drug, duration of action, onset. So we are now receiving 16 responses, 18 responses out of 35 students who are now attending our online class. Okay, so is 22 acceptable? Not yet. So we are inviting the others to please post your answers so that we could evaluate. So from the 23 responses that we have now, most of your responses are letter A. So let's see if your responses are correct. So the answer is letter A, bioavailability. Because the half-life is considered as 50%, duration of action is the length of time of having the therapeutic effect of the drug, and onset is the beginning of the therapeutic effect of the drug. Let's have the next question. The next question, the nurse administers a drug. Nako, mukhang it seems that you are guided. On the right time and frequency, since the blood plasma concentration reaches 50%. Post your answer. Is it half-life? Is it bioavailability? Is it duration of action? Or letter D, is it onset? So post your answers. 18 responses now, 21 responses. Very fast because I know you are really confident with your responses. So out of the 35 students that we have, 28 responses, 29 responses as well. Let's see. So we're still missing the 7. Okay, still missing the 7. A while ago we have 38 attendees, so we are missing 31. So we need the other 4. Okay, the other 4 students to cast their answers. So most of you, almost all of you, have answered letter A. So correct answer, it is definitely letter A. Okay, next question. Next question is that of we have, Let's post the next question. Okay, it's not posting. Okay, next question. Okay, next question. The nurse is aware that a manifestation has been observed. The maximum blood concentration level. Is it letter A, onset? Is it letter B, peak concentration level? Is it letter C, route of administration? Or letter D, half-life? The nurse is aware that the manifestation has been observed at the maximum blood concentration level. So, is it onset, peak concentration level, route of administration, or half-life? 26 responses. Let's see. Okay. What could be the guide in the question? If we are referring to maximum blood concentration, onset is referring on the beginning, half-life is 50%, the route of administration is referring on the site. So obviously, with the 28 responses, hoping I'll check if, okay, consistent. The same answer. Let's see. The answer is peak concentration level. Okay. Next question. Next question is referring to the nurse considers the time interval when drug is administered until therapeutic effect begins. We have bioavailability, peak concentration level, onset of action, or first pass effect. Again, the nurse considers the time interval when drug is administered until therapeutic effect begins. So we have already 21 responses. Thank you for those very prompt responses because that's very evident that you're confident with your responses. And let us check with the 25 responses. Now, consistently, okay, very consistent. Your answer is letter C. Let us check. Bioavailability, we're considering the 100% effect of the drug. Peak concentration level, we are considering the maximum effect of the drug or level in the plasma. First pass effect, this is the liver metabolism of usually orally administered drugs. So the answer is obviously, oops, we have the onset of action. Correct. Okay, so I think that is already the coverage of our discussion because this will be the coverage of our succeeding discussion. So I'll just stop our sharing. Okay, so let's stop the recording.